is Katie and I'm a sophomore nursing student. I think being a nursing student is different from a lot of the other majors because on top of all of our classes, we also have to go to clinical. So nursing classes are typically 2 hours and 45 minutes long and they are once a week. And then a normal clinical day starts at 7, so I'm typically up around 5:30 to be there on time. So the first thing we'll do at clinical is we'll get report from the nurses, and that's where the nurses on duty at the facility will tell us any changes that have happened in a patient, either in the previous shift or in the week leading up to clinical. So an example of a report would be patient X fell on her way to the bathroom last night and hit her head, so we're currently watching her for any changes in her level of consciousness. So after we have a report with the nurses, we'll have a pre-conference with our professor where we'll talk about what her expectations are for the day and what we're going to be doing with the patients. So after our pre-conference, we'll have patient care where we'll do anything from administering medications, bathing the patients, and anything else that the patient might need depending on why they're in the facility. So when we're administering medications, we have to have a professor with us to prevent any medication errors. So when the professor's with us, she'll typically ask us questions like, why are you administering this medication and how much are you giving? And this prevents any medication errors because you don't want to give a patient a medication they don't need based on their diagnosis, and you don't want to give them too much because that could be potentially life-threatening. So after nursing care and patient care, we will have a post-conference around 1 o'clock, and that's where we talk about everything we did throughout the day, what we did to help our patients, why we did that, and then clinical is over at 2, so it's typically a 6-hour day. So all tests done for nursing classes are done online in a computer lab during your regular class time, and you'll get your grade back as soon as you hit the submit button, which can be a little nerve-wracking. But I will typically start studying for a test 2 weeks before the actual test, with studying every night the week before the test. So I think studying with friends is really important for nursing students because they can ask you different scenarios to test your knowledge. And this is really important because a good chunk of the questions on our test are all scenario questions. So an example would be a patient presented with chest pain and had changes in her SNT wave on her EKG. What's wrong with her? And then the next question would be something like, how would you care for this patient and what are some things you can do for her? And it would be a select all that apply question because there's never just one thing you can do to help a patient.